So one of your patients being diagnosed with HIV, he's currently having unprotected sex with his partner and is something like fertility positive. Should you inform the man's partner of his HIV status? I think that in this situation, the patient's confidentiality can be breached. I think that it's important to maintain that, however, in some situations, this is a very severe situation where not breaching the patient's confidentiality would actually put their partner at risk. And I think that immediately responding to the situation, I'd be willing to have a word with the person who's been diagnosed with HIV, because I think it's very important to understand why they don't want to tell them and why they would be willing to put their own partner at risk. So that'd be a conversation that we'd obviously need to have. I think that in a severe situation, I'd be breaching the patient's confidentiality might be necessary, because if that's going to put other people at harm, you can argue that not breaching confidentiality would actually be breaching the normal license couple, because that's putting someone else at risk where you know that there could be a risk of them contracting HIV, however you've not done anything to intervene with that. So I think, obviously, in most situations you don't want to be breaching that confidentiality, because it's very important to maintain that. However, in a situation as serious as this, you would maybe need to take the necessary steps to inform them. I think that because, there's fine lines between everything, I think I definitely consult some of my senior colleagues, obviously what's maintaining confidentiality on my end, but I'll see what they think about the situation, because it's very tricky, and I think getting guidance from other more experienced colleagues would be better. I think that the patient himself or herself, we would need to be having a word with them, like I said before, also not from a kind of accusatory standpoint saying why would you put them at risk, but also just checking as to why they feel like that, if there was any potential embarrassment from them, or if they just were too scared to tell them, because then that would be something that we could intervene in and say it's okay, we can help you to take the necessary steps to inform them without maybe damaging your relationship, which might be a common fear they have. So I think you definitely need to understand where the patient is coming from if they don't want to tell them, because there's obviously always a reason for the way they want to act or not disclose things. But breaching that confidentiality is obviously not something that we want to do. However, in a situation like this, a severe case where other people are being put at risk, it might seem like the necessary option.
Okay.
Anything else you'd like to say? I think that confidentiality is really important, but especially for patients, they value being able to come to health professionals with their information being trusted and kept very confidential and not disclosed to anyone. But when they're not telling their own partner about something that could potentially impact them, you might think that maybe they aren't as educated as well implications to their partner, because people don't know much about the transmission of HIV, because it's not really something that's covered often by the media. People have basic awareness of these illnesses through the news, but again, it's not really covered much, because HIV hasn't had like a large epidemic recently, I suppose, so it's not really covered in the mainstream media very often. So you could obviously argue that maybe due to lack of information that they might not want to disclose it, because they think, I'd rather keep it private and not worry them, rather than thinking that might impact them negatively, so I'd say something. So I think that also plays into it a lot. So
Good. Do you want to give this feedback here? Because you have done very well, but you could have added one line. What are the situations where patient confidentiality can be breached? You want to add another HIV patient with having sex unprotected?
Yeah, so in the vast majority of cases, you can't breach confidentiality. But if another patient's life is at risk, or even to some extent society, this is a new thing throughout, because if society is going to be at risk, then there is a duty for you to breach confidentiality, or an obligation for you to breach confidentiality. So something like the HIV, or somebody driving around with epilepsy, for example, who might cause an accident, you would first initially encourage them to do it voluntarily. But if they persistently refuse, or you have evidence that they're not complying, for example, you see them driving outside, and you told them then you've got an obligation to act.
Yeah.
So you answered very well. I was, will just get between 7 to 8 from this answer. I was waiting for you to come out with a simple one-line sentence. What he said, that you don't breach patient confidentiality, but there are exceptional circumstances.
Yeah.
For example, suppose I get a patient who is stabbed. Suppose I'm going now at the end of it and I get a stab, and when I brought to the hospital, my patient confidentiality is not important because it's a stabber who can stab 20 other people in the community.
Yeah. Yeah.
So they will inform the police without taking my permission because I have a stab victim and the stabber is still outside.